And so a business coach told me that I should narrow in on an emotion, and I chose anxiety because it is huge and I have experience in it. And my daughter has anxiety. And so I kind of feel like I've seen the parent side of it and the clinician side of it. So that's when I decided I'm going to build this business. And way back in the day with Dr. Laura and those kind of like
Yes.
radio shows, I remember I want to have a radio show. But back in the day, I don't even know how you get a radio show, but I don't think I was, it wasn't easy to do.
No.
And so it was kind of like this dream, but I didn't actually think I would ever be able to do such a thing. And when podcasting came along, I was like, "Oh, I can have a radio show because I just create it myself and I just
Mhm.
put it out there."
Hi, and welcome to Beyond Empty Nest. I'm your host, Jody Silverman, speaker, mentor, and Chief Dare Officer at Moms Who Dare. Every Thursday, I'll share stories of midlife transformation, happiness tips, and dare you to see the opportunities waiting for you so that you can make this next chapter even better than the last. If you're ready to dare, I'm ready to dare with you. Let's get into today's episode. If you're a parent, then you know that navigating anxiety with our children can be both frustrating and challenging. Hi, everyone. Welcome back to Beyond Empty Nest. I'm Jody, and today I'm joined by Cynthia Coufal, a teen anxiety coach and the voice behind the Teen Anxiety Maze podcast and YouTube channel. With over 3 decades of experience as a teacher and school counselor, Cynthia now helps teens across the country and around the world understand and manage their anxiety. And today, she's here to support you, the parent. In our conversation, Cynthia shares how to recognize when your teen or young adult might need help, what to do if they say they don't want it, and how to start meaningful conversations about anxiety. We also are going to explore her own inspiring midlife pivot and how she's helping young people discover their strengths and purpose through the UMAP assessment. So take a deep breath, grab your earbuds, and get ready to dare on, even when parenting through anxiety feels like a maze of its own. Welcome
Mm.
to Beyond Empty Nest, Cynthia.
Oh, thank you. That was a wonderful introduction. I loved it.
Well, it's an important conversation. I mean,
Yeah.
it's an epidemic. Anxiety is
Mhm.
everywhere.
Mhm.
Real anxiety, not the ones where, oh my God, I'm anxious today. I'm having,
Mhm.
how we casually use the word too, which is dangerous. Uh,
Right.
but it is an epidemic out there. I don't know anybody who doesn't have some level of anxiety in their lives. And we'll dive into like when do we know when our teen or young adult child, needs help with anxiety. But before we jump to that topic, I always love to start with my guest stories because I know that you have your own midlife journey and your own stories.
Mhm.
So share with our viewers what you would like them to know.
Okay. Well, I got married at 19, so I felt like I had like such a, I guess, full life, if you would call it that, from early on. Like I didn't really have like that typical college experience. And even though I did go to college, I was a non-traditional student driving there every day, coming home to, I had a stepson in my first marriage. When I was 19, he was already when I was 19, he was almost 4.
Oh, wow.
So I was raising him because his mom was not in the picture. And then I had my own at 22. And so I navigated college, master's degree, all that stuff while I had kids. And it was kind of crazy. But he was not a nice person, as you can imagine. Getting married at 19, I didn't choose wisely.
Okay.
So, I did stay with them for a long time because I just kept thinking I could make it work. But after 20 years, that I knew it wasn't going to work, and I was almost 40 at that point. So I moved to a different town because I needed to get away from him. And all this time, I continued working full time. I worked full time I was a teacher and a school counselor, and I got a job at 22 and I worked full time until I could retire. So, 3 years ago, I retired and I knew that I still had so much stuff to do. And I was actually really excited about it, retirement, because I already knew I'm going to be a coach. Now, I didn't
Oh.
know, I knew I was going to coach teens because I've worked with teens my entire life and I love them, but I didn't know what I was going to coach them on. I just thought about everything. And because I worked in education, I knew nothing about business. So I was just thinking, well, I'll just tell people, hey, I'm going to help you with everything. And all these people would come.
How'd
And
that
that's not how that worked out. But I am getting it figured out. And what's so fun about this time in my life is, I am an empty nester. My kids are adults and have moved on. My husband has two adult children who are married. We have three grandchildren. And so my mother-in-law does live with us. So we do have a third adult who lives here, but mostly I have all this time. And so I am just pouring it into figuring out business and making my podcast and my YouTube channel grow and affecting having teen clients and helping their parents with anxiety. And anxiety came along later when I started with just, I'm going to help you with all your emotions, everything you want to work on. And then no one was finding me because people aren't looking for they're looking for specific help on things. And so a business coach told me that I should narrow in on an emotion, and I chose anxiety because it is huge and I have experience in it. And my daughter has anxiety. And so I kind of feel like I've seen the parent side of it and the clinician side of it. So that's when I decided I'm going to build this business. And way back in the day with Dr. Laura and those kind of like
Yes.
radio shows, I remember I want to have a radio show. But back in the day, I don't even know how you get a radio show, but I don't think I was, it wasn't easy to do.
No.
And so it was kind of like this dream, but I didn't actually think I would ever be able to do such a thing. And when podcasting came along, I was like, "Oh, I can have a radio show because I just create it myself and I just
Mhm.
put it out there." And so this is kind of something that I dreamed about a really long time ago, but I didn't, when I was dreaming of it, there was no such thing as podcasting. So it's just been fun to figure it out, and I love this is the best time of my life, not only because I'm married to a nice person,
Yeah.
but
Helps.
I also just oh, it does, definitely. But I love all this learning and figuring things out, and I can be exactly who I want to be, and I can build this business around who I am, and it's just a perfect combination. So I'm excited about this part of my life.
Oh my God. If you're listening to this, I want you to stop, go over to YouTube, or go over to jodysilverman.com, go to the podcast, find our YouTube video, and I want you to watch that again as Cynthia told her story because you were so lit up. You were so lit up, and that's what midlife can be. That's
Yeah.
what this next chapter, whether it's empty nest, whether you still have kids at home, this next chapter can be all lit up because it can be that you just start a side gig
Mhm.
while you wait for the more space to open up. And
Yeah.
by the way, when you do that, that makes this other stuff over here that you're not loving anymore a little bit better. So, but I love
Yeah.
it. And I love what you said so much. First of all, thank you for sharing your story. Um,
Sure.
I don't take it lightly when people share their stories because we all have stories. And when we share our stories, and you know this just from being who you are in your podcast, we know somebody out there shares a part of that story with you. So thank you.
Mhm. Mhm.
But I love when you said, first of all, nobody today, nobody in this generation is going to get a job at 22 and stay till retirement.
Mhm.
And there's something to
Yeah.
be said for that. So yay. But I like when you said you retired and that you knew you had so much more to do.
Yeah.
And it's that knowing, it's that
Mhm.
feeling of knowing that there's something I am still meant to do or something else. For you, it was similar to what you were doing, but now you were shifting to be on your own in a different type of capacity. I had
Mhm.
that knowing too. I knew I wanted to do something new and different and more. There was something more for me. I didn't know what it
Hmm.
was though, but for me, I didn't know what it was. So I love that you share that because I think so many women and men, but because our show really does focus a lot on women, so many women have that feeling of knowing there's something more, that wanting, that desire for more, and not knowing where it is. And if you do, take action on it. If you don't, it
Hmm.
will appear. So
Right.
I
I
love,
really think that there's a way you can create it. I remember there was a lady that worked with me when I was getting ready to retire, and she was my age. And she said, I'm scared of retirement because I don't know what I'm going to do. And I said, well, what do you dream about? Like, what's something that you are so passionate about? And she said, I used to work in the library in like a children's area. And she said, I had so much fun doing that. And I wish I could continue to do that. And I said, why can't you just create that kind of setting somewhere and make it happen? Now, I'm not saying she did it. I wish I had that end of the story that she did go do that. But to me, I am one of those people that if I want something, I'm going to find a way to make it happen. So I just kept thinking if I could inspire her to take that dream that, oh, I loved it when I did that. Okay, well, figure out how you can continue to do that.
I love that.
And
Okay,
I
right
know,
there.
and I just think anyone can do that. Like, take whatever is so exciting to you that you remember from way back or what you're doing right now. Because I've always loved working with teens. So that has always been kind of like my thing. But everyone has a thing. And sometimes they've forgotten about the thing or they thought, oh, it'll never happen. Like oh, I'll never have a radio show. Well, now I do, kind of. So
Yes, you
it's fun to like
do.
just create what you want in the world.
And I love it. That's the daring part. What is it that you've dreamt of? What is something you did that you love that like when you think back, it was so much fun. We can do something that's fun
Hmm.
just for fun's sake and to make an impact. And you could do for fun's sake and impact and make money. It doesn't matter.
Yes.
They're not
Yes.
mutually exclusive. You can have them mutually exclusive. If you don't care, money is no object, that's fine. Then go do something fun and make an impact.
Hmm.
But you can also make money if
Exactly.
you so desire to. And
Yeah,
I think that's I love how you said that. I mean, I have just so many ideas for her just popped in my head. So
I know.
I will add on to that. Was something that you dream about or thought about doing or something you really loved doing in the past that you let go of? And then how can you bring it back in a way that really feels good for you? And call a friend, call Cynthia, call Jody, call a friend and say, I have this idea. Brainstorm with me.
Yeah.
I'm going to tell you right now, I will put that offer out there to anybody listening, any of my listeners. You have an idea, you want 30 minutes of a brainstorm, reach out to me. Let's do it. Let's do
Yeah,
it. I
that
want you
sounds
to
fun.
dare. Yeah. All right. So I love your story. And we could go on and on and make this all about daring for us, but we want to talk about something that really does affect so many children. And it's affected my children. And as parents, it can be a really sad, frustrating, helpless place to
Hmm.
be
Hmm.
when you feel your child is struggling with anxiety.
Hmm.
And I guess the first place is, you know, when to know when your teen or your young adult needs help with anxiety. Like, where do you begin?
Well, and it is tricky because as teens, what's normal is so the spectrum is huge. Like they could be not functioning as well as your friends, and they're still your friends' kids, and they're still okay. But the red flags to me are if they're missing a lot of school. Now, I had kids once that would want, even my own children, once in a while, they just got overwhelmed, too much homework. I didn't sleep very good. Okay, let's take a mental health day. Let's just stay home. But I had kids that would miss, I don't know, 40 days out of a semester or
Ooh.
whatever. That is too many days. And if they literally can't get out of bed to go do school or work or, life
I would say,
things,
how about meet up with their friends?
yeah, because that sometimes they don't want to do that either. Or they lose like something they did enjoy doing, now they don't enjoy doing it anymore. All of those to me are those red flags, or they're failing a lot of classes where graduation is in jeopardy. Um, it could be a lot of things. It doesn't have to mean that that's anxiety specifically, but those are things that you need to find out what's going on. And Sometimes I find with families, and I wish mental health did not have the stigma that it does, but it still does. And we're working on it. We're making it
We
better,
are making
but
better.
it is still sort of a shameful, it shouldn't be, but some people are feeling shameful about it. And so if you or your child is feeling shameful about it, start with your pediatrician or your general practitioner. Now, they don't know a ton about the mental health part, but they can refer you. They can, and sometimes you need to look at the physical symptoms. Sometimes the physical symptoms are meaning something else is off in the body that is then creating an anxious feeling or a panic or depression
Mhm.
situation. I had a girl who she was doing a lot of self-harm. She was carving words into her, I think they were into her thighs because she didn't want anyone to see them.
God.
And she was taking irons and just burning herself with an iron. It was like, and she didn't come to me because she didn't want anyone to know, but her friend was very concerned, and her friend brought her to me. This is when I was a school counselor. But so she made her come to me, and she did not want to talk to me. And I don't think she barely said any words. I think her friends did all the talking for her. But I said, I'm going to have to call your parents because, this is dangerous stuff that you're doing. And she hated my guts. She even wrote a letter to me and put it under my door the next day about how I was the worst person she ever knew. I cried about it for a while because I hate kids to not like me. But her parents took her to their general practitioner, and she actually had a thyroid disorder, and that those chemicals being off in her body were creating this depression in her that was causing all this outward behavior. And I think she was a sophomore when I called her parents. She never spoke to me again during high school. And the last day of senior year, when she was a senior, she came to my office and she said, "Thank you for calling my parents because
I'm
I
crying.
got the help that I needed." And she became a teacher. She taught
I'm
math.
gonna cry.
She just went on. You know, th- so sometimes there are physical things that we don't know about
So
that we
strong.
do need to look into. But even if there's nothing physically wrong or no disorders or chemicals being off, that doctor knows some therapists or knows a clinic or knows, like they can refer you on to the next step.
Yes.
I do caution people, don't just get antidepressant medication from your doctor with no talk therapy. I don't think, I mean, that might alleviate some of the symptoms, which will feel better for your family, but don't disregard the talk part because really the medicine can help you feel better, but you really need to change your mind. The thoughts,
Absolutely.
there's so many things that you need to work on when you have anxiety and depression and panic. And so just taking medication is not the answer to that.
No, that doesn't
And
get to the
so,
root problem.
no,
Medication can
no.
actually clear the person so they can have the ability to talk through.
Yes, exactly. That's what it's really for.
Yeah,
And sometimes people only have to take it, like, especially if they have a situational anxiety or situational um, depression, and which I don't really work much with depression, but they're kind of related.
they
When
are.
they're
I
when
can
it's
tell you firsthand they
situational,
are. Yeah,
yes. And so taking that medication can help you through a certain season of time where then you feel better, the situation's over or whatever, and maybe you wouldn't have to take it long term. But even if you are somebody who needs to take it long term, again, taking the shame out of mental health, I think we need to look at antidepressants and anti-anxiety medication and all of those things. It's just like if somebody had diabetes and they needed to have insulin. We don't say, "Oh, well, what's wrong with you? Just stop having diabetes. Just stop feeling like that." Well,
I
they can't do
know.
that.
I
And
know.
the people that have anxiety and depression for real, and we all have it, but those that have diagnosable anxiety, depression, they need those chemicals. For some reason, the chemicals in their brain are not producing enough of the feel good, get yourself out of this feeling chemicals, and that's what the medication does.
I love
And
that.
so, some parents come and they say, "I don't want my child to take medication." And I get it. I understand. I don't think you should jump to it without, thinking about
There's a
it.
place for it.
But yes, but I want people to be okay with trying it if that's if we get to that level. Like if we've done
Okay.
all these other things, then that might be something you need to do.
Okay. I love that. All good stuff. Um, what do we do when we know our child needs help? We know something's wrong. We know something's up.
Mhm.
I don't know if it's anxiety. I don't know if it's depression. I don't know if it's bullying. I don't know what's going on, but my child is sleeping too much, not going out with their friends, not talking to me, not doing well in school, all the things that we just talked about.
Mhm.
And you say, you know what? What's going on? We need to talk about this. And if you don't want to talk to me, we're going to talk to someone. And they say, I don't need to talk to somebody. I'm fine. I'm fine.
Uh-huh. And
Is
that's
that
probably what they are going to
Yeah,
say.
absolutely? You're going to say, I don't want to talk to anybody. I'm fine. I'm fine. I'm fine.
Yes.
I know what
So,
in hindsight, I will tell you what I would do, but I want to know what you would tell somebody to do.
well, I tell parents to be patient and to be present with them. Like, don't let them off the hook by saying there's nothing wrong. I don't want to talk to anyone. Because sometimes, and I was guilty of this too, when my child said, don't, there's nothing wrong. Don't worry about it. I would take that as my, oh, good, I don't have to worry about it. Or, oh, good, I
Mhm.
don't have to think about it. But it really isn't. It isn't
That's
our way
denial.
off.
That's a little
Yes,
denial.
yes,
And
yes.
moms, parents out there, we're not judging you.
No, I had
I
it
was like,
too.
okay, maybe there's nothing. Maybe it is just me because it made me feel better, even though everything in me knew that something was wrong.
Exactly. But we need to keep revisiting it, but in an open way. So continuing to tell your child what your concerns are. I really, I see that you're not doing any of the things you used to enjoy. You're not going to school, and this is really important that you do have to figure out how to go to school. So we've got to sit down and talk about this, and ask them, do you even know what's wrong? Because sometimes they literally don't know
Right?
why they feel that way. And but sometimes they do. So like trying to piece out that, like, do you really not know what's going on? Is there something that's happened that you're avoiding? Is there a person, a teacher, a situation? Um,
Or just,
and ask them what is your brain telling you when it's time to go to school or when it's time to go with your friends? What is your brain telling you? And trying to see if you can get into what is really the reason why? One of my clients said, whenever my friends ask me to do something, I immediately feel dread. And I'm glad she's pretty mature for being able to say that she feels dread. And I'm like, well, what are you dreading? When you think about going out with your friends, where's that dread coming from? And she said, well, sometimes when I go with my friends, I think I feel trapped. Like, this might be boring and what if I would need to get away from them, or what if I don't want to be with them, or what if I feel uncomfortable, or what if this happens or that happens? And I'm like, have any of those things ever happened? And she said, no, when I go, I actually have a really good time. I just always dread it so bad. I can barely make myself go.
wow.
And I said, well, what would happen if it was really boring and you felt trapped? I said, could you call your mom? Could she come and pick you up and take you home? Could you if she's driving herself, could you just say, oh, I have another appointment. I need to go. She was like, yeah, I could do that. And I said, so are you truly trapped if you were to go with your friends? And she was like, oh, I guess I'm not really trapped. And so we just had to like pull out all of that stuff and then look at it. And I would have parents, not in an accusing way, but everything that they say might happen, or, what if I get hurt? Or what if this person says this? Or what if this happens? What is the percentage of chance that that actually would happen? Is that really a true thing? And a lot of times, like one of my clients didn't want to go to Taekwondo because he said I might get hurt when I'm there. I'm like, yeah, that is definitely a possibility that you could get hurt. I said, how long have you been in Taekwondo? And he said, well, I've been in it about a year. I said, have you ever gotten hurt? Well, no. I was like, okay, so let's look at the percentages of going there and getting hurt. Yes, we can't say zero because, yes, there is a chance. But is it 1%? Is it maybe 5%? And you're not going and you like it for this tiny, we can't even see it percentage that might happen. And I said, what would happen if you did get hurt? What do you think? What would I don't know, what are they called? The dojo? What would that person do? Or what could they call the doctor? Could they call your parents? And we just kind of like
like
instead of making the story so scary and big,
you're breaking
what
it
if it's just,
down.
but yeah, like what if it's just not really that big of a deal? And he started going and having fun and he didn't have problems with it anymore.
So
So I think just talking, being open-ended, being non-judgmental, being a safe place, um, to hear whatever they have to say, even if you don't like what you're hearing, just, just take it in, listen.
and don't you?
Um,
But it's an important thing that you're saying here, Cynthia, is you're not you're. I needed to hear this today, by the way. I just let you know,
good.
I as a mom needed to hear this today. Um, you're not trying to fix it for them. You're
Mm-mm,
trying to get
no.
open their eyes for them to see what's the worst case, what's the best case. Has this? It's you're actually having questions like, well, has that happened?
Yeah.
And I love how you start out like, has that happened to you? No. Okay. Well, what if it did happen?
Hmm.
Might you be able to? And I like that. Like
Yeah.
it's the open-ended questions, non-judgmental, and what you just said. Even if you don't like what they're saying, don't jump in and say, no, 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 no. Like, okay, what makes you think that? Or I don't know.
Hmm.
I love these questions.
Right. Well, and another one I was thinking of too, because we do want them to get to the point where they are solving their own problems, because we are raising people to be independent of us, and we can't be solving their problems for them. Even as a high schooler, they need to be solving most of their problems on their own. So,
And when they go to
asking
college
them,
and out in the world, they
yeah,
need to be
they
able to.
have to
That's
do
our
it.
job. Yeah.
Exactly. And there's going to be problems that they can't solve, and they can ask you about it and you can help them. And even, but start out with what ideas do you have to deal with this? Or I used to say to kids who came to my office and didn't want to go to class all day and they were really overwhelmed, I would sometimes let them stay for the day without forcing them out into class. But I would tell them, this is the only day you can do this. So what's your plan for tomorrow when you're going to feel like this again, but you have to go to class? What are you going to do? And putting it on them. What's your plan? What are you going to choose to do? Because then they will hopefully come up with something that they're going to be willing to do. If we're coming up with all the plans about how they're going to fix everything, that might be they're going to rebel against it because it isn't something that they had a part in. So asking them, and it's okay to ask them, do you need some help with this? Do you need me to come up with some ideas? Do you need me
Right.
to help you talk to somebody? Do you need, like, what do you need from me? But first of all, what can you do, or what are your ideas about fixing this situation? And I think um you may have to do this for a while, especially if you haven't built this kind of relationship with them before. And now, as a teenager, all of a sudden you're throwing out this new tool of
Well,
I'm
yeah.
gonna be open-ended. We're gonna talk about these things. They're not gonna do it right away
No.
because they're gonna be unsure about, oh, what's this about? What's the trick? What are they trying to get me to do? But the more you stay calm and safe and non-judgmental, they will, because they don't want to feel this way. They want it to go away. They just don't know how.
Yeah.
And they probably think you can't fix it. They probably think there's no way to fix it. And so that's why they've maybe been shut down from it, or maybe
Um,
past relationships with you have made them feel like I can't talk about anything because they're going to get mad or they're going to, judge me or say all these things. So, or try to fix it for me. So once you try these things, might have to try them for a while, but I just know they would open up after they felt like, okay, this is safe and I can help make these decisions.
Okay, and they might open up, but like I get the whole like, going back to the original question though. They say no, 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 I don't want to help. I don't want to help, and you be patient, but you know they need help, and you know it's beyond you. You know it's beyond what you can do because all those questions really tie together with like okay, that's also a great way to start the conversation
Sure.
about bringing it out in the open that there's something going on. You don't have to name that it's anxiety. You don't have to name just I noticed this and all of that.
Hmm.
But I want to go back to I mean. I don't know.
If
My
it's
child said
scary,
my child said years ago, yeah, I mean, long time ago, before high school, everything. Um, I knew something was off. I knew there was
hmm
anxiety.
hmm
And but there was prepubescent, there's a difference.
yeah,
There's a difference. And I'm like, well, we're gonna go to a talking doctor, a doctor,
hmm
a talking doctor like that. But when
Hmm.
you get into that prepubescent stage, at middle school, high school, and they say, I'm not going, I'm not going, you as a
Hmm.
parent have the right to make them go anywhere until they're 18. How,
Right.
how do you do it? I mean, I have a family member who, when forced to go as a teen to talk to a therapist, a psychiatrist, walked in, turned the chair around the other way, and sat with her back towards the doctor.
Yes. And kids will do that. And kids have done that to me before, not
And
in
for
this business,
$200
but
an hour, that's a lot of sitting with your back towards the doctor.
right. Well, and it's going to take the doctor some time um to get them to warm up to this situation.
But
I mean, that's
is it like, if you're not okay, so if you don't want to talk to me, I know your mom, you don't want to talk to me.
mhm, right.
But you need to talk, you're going to get to talk to somebody. So it's me or this person. But if you say that, if you have a really smart child,
Hmm.
they're
I
gonna,
think giving them choice, like I would say either come up with like five options that you are okay with. Like we're going to
okay,
talk to your pediatrician first
okay,
or have that person on the list because that's
okay,
a less scary option sometimes for a
yeah,
kid to go talk to. But they're also going to have influence, especially if they've already, your child knows them.
okay.
Um, as you know, and as I know from my own kids, our teenagers will listen to other adults way before they'll listen to
Oh,
us.
hell yes.
And so even if it's like a coach or a teacher they like, or someone at your church, or a neighbor guy they really
Who would you
enjoy.
want to talk to? If
But yeah, like
something's
find like
popping,
a list
yeah,
of like five
yeah.
people that they would be willing to talk to. And then, that's like the first step. Now, obviously, if they need therapy, which a lot of times the stuff that we're talking about, they are going to need a talk therapist, somebody who's
Yeah.
trained in this stuff. But if you can get them to open up to the neighbor, or you can get them to open up to your general practitioner or whoever, that's a step in the right direction.
Yeah.
And that neighbor, I mean, you could see this is what I'd be doing as a parent. I'd be secretly talking to the neighbor like, can you talk them into going to the
Absolutely.
talk therapy, because they will have the influence to be able to do that when you don't. um so often have thought my tagline in my business should be a voice your teen will listen to, because teens don't listen to the parents, but they do listen to other adults. And it's just, it doesn't matter how open and you know
I wouldn't
non-judgmental
listen
we
to my
are.
mother as a teen. No way. I'm
Oh
like,
no,
oh,
I
there she
no.
goes again. She
My
knows
mom was also
everything.
judgmental.
Yeah, she
Yeah.
she knows everything, and
Mhm.
it's not her fault.
Yeah.
I have great
No, no.
mom, great
Oh,
moms.
wait, yeah.
It's
Yeah.
just a fact of life.
Yeah,
Just the
exactly.
way.
So, rally around, get some adults in your child's life that they say they're willing to talk to, not just ones you want, but ones they're choosing, but then maybe having those conversations with them on the side, just saying, I'm really concerned and here's what I'd like them to do. I wondered if you could help me, you know, uh, make this a softer ask
I like
than it's going to be.
I like that. All right, I want to pull this together for the parents. So the title and the topic today was supporting our anxious children, real talk for real parents. And you've put a lot of really, really good tips and strategies out there. And the first step, I would say, is to pay attention. And when you notice change, my takeaway from what I just heard you say was, when you notice something and you
Hmm.
feel it, we know it. We know it in our being, ladies. We have that knowing.
Hmm.
There's a chance there's something. Don't
Hmm.
name it for them, but patiently and without judgment, ask them. Tell them what you're noticing.
Yeah.
So give us three points that you want to sum this up. Like, notice it, tell them what you're noticing. And I don't know, take us through like everything we talked about, because you said be patient, be present, open-ended questions, no judgment, like all of that's good. Give us one
Hmm.
parting statement to tie it together. And then there is a dare we give everybody. I'm not sure if you remember what your dare is, but I'll give you time to think about it. But yeah,
Okay. Um, well, when you were kind of putting some of that together for me, I was thinking about my four N's to manage anxiety.
there you go.
And it is notice. So we can use that in this situation too. Like we're noticing about our kid that something is not right. We have that inner knowing. I always tell parents when they would ask me, should I do this? Should I do that? I'm like, what does your mom sense tell you? Because your mom sense is really good. Like we were given that gift of knowing. Sometimes it gets a little haywire. Sometimes I think something's wrong when it's not as wrong as I think it is. But
We
for
can
the
get
most
our
part,
ego can
yeah,
get there. Mix it. You have to say,
yeah,
okay, is this why am I wonder why I'm feeling this about him or her right now? And you can
right.
separate the truth from what your fear and unwarranted fears. So
Sure,
this,
right. The second one is to normalize. Now, we don't want to normalize behavior that is harmful, but for the most part, it is normal to feel anxious. Everybody feels anxious. Sometimes with kids, when we normalize it, we talk about it in a normal way. Like if they say, well, I don't know what's going to happen at school, at my new school, so I don't want to go. Of course, people would be anxious about a new school. Of course, every new kid is going to wonder, are they going to have friends?
got
Where are
it.
they going to sit? What's going on? So you're normalizing it.
Normalizing it. Okay.
Then you neutralize it, and that's that reframing and asking the open-ended stuff, like, well, would that really happen? And if that did happen, what would you do? Because that's like making it more neutral, taking that fear and the bigness and the tragedy out of it and just making it regular.
I love that.
And then next best action. And so then you could ask your child, okay, what's one step forward towards school that we're going to take? What's one step towards taking that test? What's one step towards learning to drive the car? Or, whatever it is that
Love
we're,
that.
trying to push them into, what is the next step? And then we need to do that step. Because when it comes time to do the step, sometimes we're like, oh, wait a minute, I don't really want to do that, or I'm too scared, or I don't like it. But helping them push through when they're uncomfortable, that that is a life skill that every single person needs. We need it as parents too. We need to be able to
Yes.
push forward into these conversations, even when we don't want to, even when it feels bad, even when we're uncomfortable. It's still important to do, and they need to learn that too.
Absolutely. All right. I love that. I love that. So, all right, there's gonna be two dares. One dare is for us as parents, and that's to get familiar and start practicing the four N's. I think there's
Mhm.
brilliant. Notice, normalize, neutralize, and next best action. Do you have a resource for that on your website or is it anywhere? But it
Well, I
doesn't.
have some podcast episodes about it
There you
where I give
go.
examples,
There you
so
go.
I could send those links to you.
We're gonna share your link to your podcast below. We're gonna share a link to your website wherever people can find you. But then so that's the dare to really get familiar with the ends. And even if it's just the noticing, just
Mhm.
start to notice, pay attention, put your phone down, pay attention. That's for
Mhm.
parents with their kids. Um, but I know that going all the way back to the beginning of this conversation about your journey, giving a lot of times I always want to end with a dare, something that gets our audience members moving
Mm.
for
Mhm.
themselves. Now, you did share one with me, and I could tell you what it is.
I
I'm,
don't remember what it
oh,
was.
I got you.
Oh, did you write it in here?
I did. I said,
Okay. Um,
but
oh, yes.
this
I
is
like
all
that
about,
one.
so this is
Yeah.
about reconnecting to you. If you have that
Yes.
something in you you want to get out of your own funk, if you want to
Yes.
discover something new and dare, I love this. Cynthia came up with this. I did
Uh,
not. This is
oh,
Cynthia's. Go ahead. What's the
well,
dare?
I've tried this before. So go on a date with yourself this week, all by yourself. Like go to an art museum, go to a park, go to the movies, go out to eat, but do it by yourself. Like just date yourself and don't look at your phone. Now, maybe not the whole time, don't look at your phone, but because especially like going out to eat, it's so easy to just look at your phone and then you don't have to be uncomfortable sitting there by yourself. But what if you just looked around? Or what if, you see someone else sitting by themselves and you meet a new friend? Who knows? But like it gives you a different relationship with yourself and hopefully a kinder relationship to yourself because women are so mean to each other and to themselves.
Yes.
And I don't I want to be kind to myself. And I catch myself saying mean things to myself, but I notice it and I try to like stop doing it because I would never talk like that to anyone else. So why would I talk to myself like that?
Well, you can use their four ends here. So I love the dare
Yeah.
to go on a date, but go on a date by yourself. Even if you're happily married or in a relationship, it's important to
Hmm.
be comfortable being with yourself. And I like
Yes.
that because I would even dare to say if you do go out for a meal by yourself, you can sit at the bar. It's always
Hmm.
more fun with the bartenders.
Oh,
I
yes.
would say leave your phone down and notice your surroundings. What is
Yes.
your
Hmm.
surroundings, right?
Hmm. Hmm.
So I would say that. And if you get nervous or anxious before you go out, check it with the four ends. Notice it.
Yeah.
Normalize it.
Yeah.
Lots of people go out, right? And then neutralize
Hmm.
it, reframe it. And I'm like, well, is it really that weird to go out by it? Not really. A lot of people do it. I love this.
Yeah. Yeah.
So you have two dares. One, start putting the four ends into practice in your life as a parent and in your life in general, because I think it's a
Hmm.
really powerful way to calm your own anxiety. It's like a
Hmm.
self-coaching tool.
Yes.
And then to reconnect to yourself, to your dreams, to what you want this next midlife chapter to be, dare to go on a date with yourself and do something this week. Do
Hmm.
something this week. You can even go on a hike by yourself, go out to eat, to the movies. We're going to post that dare down below.
Yeah. Oh,
Cynthia,
I
this
like it.
has been a really valuable and really great conversation. I've loved it. I hope our audience loves it. Thank you for being part of the Beyond Empty Nest family. We'll share all your links below for additional support. And if you need additional support with your teen or young adult, Cynthia is the person to call. I would trust you with mine.
Oh.
And I want to just thank everybody for being part of the Beyond Empty Nest audience. Share this episode with a fellow mom that you know needs extra support with her children. I don't know
Hmm.
anybody who doesn't. This is the episode, a very important episode, worth sharing. So dare to share, dare to tune in next week for another episode of Beyond Empty Nest. And as I always say, dare on. If you've enjoyed this episode of Beyond Empty Nest, head over to jodysilverman.com for full show notes and resources. But wait, before you leave, I have a question. Are you happy in midlife? Take the midlife happiness quiz today and discover your personal happiness score. Not only will you uncover where you stand on the midlife happiness scale, you'll also get 2 free tools to help raise it even during difficult and challenging times, leaving you feeling confident and happy from the inside out. It's time to shift your mindset from victim to victor and start boosting your happiness today. Ready to unlock your next chapter of joy? Click the link in our show notes to get started now, because happiness is an inside job and you deserve to feel happy. Dare on.